It's so difficult sometimes to see a pregnant woman that carried that baby for 9 good months. And when it comes to just few checkily time, make she delivered. And then they will be running helter skelter. Not even for money, not even to buy clothes for the baby, but the fear of Nigerian hospital. That is the wisdom of a pregnant woman. There's this guy that the wife got pregnant and he tried every means to make sure that things work out kajai. They were looking for hospital here and there because the woman was really pressed. The husband carried his wife, put that wife in the car with the help of neighbors, and they drove everywhere around Lekki axis. They looked for hospital where they would take chicken money from them. At least may they save the mama or may they save the pikin. But come to think of it, the time they got to the hospital, according to the husband, which I will play the video later, the husband said the hospital rejected her for not being able to deposit 500,000 naira. That means they take money above rescue of human being. The hospital said no, without deposit of 500,000 naira, there's no way here. They now advise this man to take the wife to a general hospital in Ekpe, while they based in Lakwe around Lekki area there. The distance from that area to Ekpe General Hospital is so far. That axis within Lekki and Ekpe, there's no any other general hospital in between until they get to Ekpe. But on their way going to Ekpe there, what happened? This woman gave up. The woman couldn't bear it anymore. So, like I said, the Nigerian authority, they put it in place before. That just take woman life first, save that life before you started talking about money. And I think also that according to the training that were given to the medical personnel in Nigeria, that safety, are we going to blame the hospital? There's possibility that even this hospital, maybe they've done it in the past. They've helped people in the past. But the people, they promised they're going to pay them, but they did not pay the hospital. This could be a reason why the hospital said, no, next time if anybody is coming into this clinic now, he or she needs to pay money before we treat him or her. Probably they are acting based on the past experience that they have, which was a bitter experience. For example, this hospital now, if at the end of the day, if they find out that really, truly, that they rejected this woman simply because they did not pay the 500,000 naira, then the Nigerian government to just make a kind of, a kind of scapegoat. Either they seize the license or they close that hospital. So this will serve as a deterrent to other hospitals who are planning to reject people who are wounded or who are planning to reject people who were carried to the hospital for treatment. Who are we to blame here? Are we to blame the hospital for rejecting this woman? Or are we to blame the husband for waiting for so long before they carry their wife to the hospital? Or are we going to blame the Lagos government who doesn't put in place a very good hospital, a general hospital in between Lekki and Ekpe? Because if this has been there, definitely they will not want to run and drive straight to Ekpe.
I'll start. I don't really know where to start from because this is one issue that has been bothering me very much. That's because I'm in the healthcare sector. I know I worked as a doctor in Nigeria for about 13 years before I left for Canada. And in my clinic, if I've not delivered children, I know I've delivered more than 500. That's because I'm an emergency physician that was also running like a clinic where it was more of like a maternity home because I had my friend with an obstetrician also coming there to work with me. So I'm going to be speaking from an informed point of view because I've had this same thing happen so many times. And, when it happens this way, nobody really comes out to talk for the hospital. Nobody comes out to talk for the hospital because no matter what anybody says, nobody will believe them. But he who wears the shoes knows where it pinches. Now, I'm just going to try to cut it as short as possible because I'm expecting my boss anytime I'm actually going to another city right now. The first thing I feel would have been the problem is the clinic I saw was a very little clinic. was a very little clinic that wouldn't have been able to manage that woman's case. Now, I can bet my life that that woman had an obstetric emergency. She would have had eclampsia, she would have had pulmonary embolism, anything that would have been life-threatening. And there is no way that clinic would have managed that. Now, so many things are responsible for clinics telling you to bring deposits. It's possible that before they tell you to bring that deposit, they need to call a specialist that will come in. And before that specialist comes in, you have to pay because the specialist doesn't work there. So the specialist doesn't wait for you to start collecting money anyhow you want to get it, right? That's number one. Number two, there are certain things that would have been needed for that woman, which I know the very first basic one is oxygen. And I can bet anything that that place wouldn't have had oxygen. Because I know that even some big facilities like teaching hospital, which I was working, I'm not going to call the name because I've been an emergency physician for 13 years. Most times we don't have oxygen. Patients go and buy. So if you don't have the money to buy, you will buy, sorry. So those are the issues. So it's a multifactorial thing, but we all have to blame it on the government. I work in Canada. Last week, I was going through one of my patients' chats, and I just saw that a consult was sent that the man just had a kidney transplant. This man has been on dialysis since 2015. He gets dialyzed 3 times a week. Trust me, I have never had a patient who have survived on dialysis for 6 months in Nigeria who is poor. But this man was just a truck driver. He was on the dialysis for free. He had the transplant for free. And I had to call my nurse. Come on. I think she's from India. See what's going on here. This man just had this thing for free without any cost and all that. She said, doctor, even the man who comes to deliver drug, who is a cab driver, just had a heart transplant surgery for free. That's a country that works. My wife just delivered. My baby is today, Thursday is making my baby 7 weeks old. I had a cesarean section done for free. The delivery, everything was free. The only thing I did was that I said, okay, I wanted to stay in a private ward. And private ward, it's, the difference between private ward and the general ward is that general ward, you have 2 people per room, but private ward is 1 person. So I just wanted that privacy because my mother-in-law was there and all that. So I was asked to pay like $300 a night, which I could pay. So I paid for like 2 nights. That's the only thing I paid. That was because I wanted to pay it. But besides that, I did not spend a dime to have a cesarean section done. That is healthcare, for Christ's sake. Why are we beating around the bush? The government is to be blamed for that woman's death. It's the government, for Christ's sake. It pays me. It is solely on the government. It takes nothing for you to make delivery free for every pregnant woman. Normally, if a woman dies in labor, it is something that should be investigated. Why? Because delivery is a physiologic event. It's like going to toilet. So it's crazy the way we take it. You hear that someone bite while urinating. That's the same way it sounds now to me. That a woman bite while giving birth. It doesn't make sense. All this talk it doesn't make sense to me. Our government is messed up. For Christ's sake, we are so rich that no woman is supposed to be paying a dime at least for giving birth. Burkina Faso is doing it. For Christ's sake, what do they have? Do you know how much we have as a country? Do you know how much? We just keep blaming the hospitals, for Christ's sake. Look at that hospital. I'm sure it's the hospital that if you go in the night, they cannot even buy fuel. They cannot even buy fuel. And the truth be told, it's possible they didn't even tell that man to bring a 500,000. It's possible they were looking for a way to chase him away that we cannot manage his case. Right? What is wrong with our general hospitals? Do you know how ill-equipped they are? Normally, deliveries like that are supposed to be done in a general hospital, but even if you go to a teaching hospital with that woman, I can bet you, with the level of healthcare we have in my country, that woman wouldn't have survived it. Because the bottlenecks in going to buy card, in going to do this, I have been an emergency room physician. Let me tell you how it works. That woman comes, especially, most of us go out of our ways to do things. We don't care. We get queries for it, but we don't care. I wouldn't wait for that woman to buy a card before I start attending to her. I'll use all the available resources on ground, believing that if the patient doesn't pay at the end of the day, I pay. I know how many times I've paid for patients. I know how many times I've donated my own blood to replace for patients' blood that I had to collect as emergency blood to give. For Christ's sake, our healthcare system is messed up as a country. A state of emergency is supposed to be declared on healthcare system. We're all blaming the hospital. For Christ's sake, what has the hospital done? The hospital has not done anything. As far as I'm concerned, the hospital can charge you whatever they want to charge you. It's left for you to say, I want to stay or I want to leave. That's a private business. It's a private business. You don't know how much they used to buy their fuel to even put on the giant, to even get a cesarean section done for that woman. They will call the obstetrician to come. They will call the anesthetist to come. There will be a scrub nurse there. There will be an assistant there. All these people, you are paying them. And those people don't work there. So they just want their money to come, go, and leave. So for Christ's sake, if I tell you, bring this money so that we can call these people, and you cannot, the normal thing to do is to look for the closest general hospital. Then who do you blame that on? Is it not the government? Now, people are saying the man wasn't ready, antenatal and all that. For Christ's sake, I have seen emergencies. So I've seen pregnant women. It's not as funny as we think. We say he wasn't ready. I've been in the house. We are playing computer game with my friend. He's an obstetrician too. With the wife, we're playing computer game, and the wife went into labor, and we needed so much blood, and the woman gave up the ghost on the table. So it's not as like that preparedness factor shouldn't come in, because it can happen to anybody. But in all this, what are the factors we must look at? The factors we must look at are things we can do to prevent this. It's on social media. The rant will go on and will leave. Normally, what I expect our legislators to be doing now is for somebody to try to be moving a bill to make sure that every pregnant woman in Nigeria has antenatal and delivery free of charge in any government hospital. But they will never do that. They will never do that. That's something that can be done in Nigeria and will stand. But they can never do that. So that if you go to a private facility, you know that you are there because you want to be there. Right? So I can go on and on, but I guess I have to leave right now.
We could see the husband begging, talking to the wife that please stay behind for the sake of your other children and for the sake of him as well. But this woman cannot hold that pain anymore. This woman gave up.
Oh my goodness, Kemi, look at me. Be strong, okay? Okay, Kemi, be strong, be very strong. Yeah? Look at me, look at yourself. Eh? Think about your kids, please. You need to be very strong for me. You need to be very strong, please. Move anywhere. Move, go, I beg. Anywhere. Be strong, please. Be strong. Kemi, look at me. Would you me?
It's okay.
Would you me? Yeah? Would you show to me? Kemi. Kemi, me. Aha. I love you so much, please. Okay, please, Kemi, please now, we are going to the hospital now. Yeah, we are going straight to the hospital now. Me, we get back here. Kemi, please, we are going to the hospital now, right now. Okay, Kemi. No,
It's okay.
God, have mercy on us. Oh, child.
It's okay.
Yeah, Kemi, can you see me? Please, stay with me. Please, Kemi. You know I love you, Kemi. You know. That's why you need to be strong. Yeah. Do you know I love you? You know. You have to be strong for Kemi. You have to be strong for me, please. Please open your eyes. Yeah? She'll be okay, Abby. Yeah? Kemi, Joe. Mo fi kunle Abby amon be Kemi, Joe. Anywhere, any hospital you can malo, anywhere. Any hospital. Joe. Arika Ije o. Jones, thank you. Bele Kemi. Bele. Wàá rúre, wàá sọ̀rè. Agbára Ọlọ́run. Wàá rúre, wàá sọ̀rè. Yes. Ewé ò kì í bọ́ lára igi kó nigi lára. Wàá rúre, wàá sọ̀rè. Jọ̀ọ́ nítorí Ọlọ́run. Ó ti rúre náà. Jọ̀ọ́. It's okay, Kemi. It's okay, be strong. Kemi, be strong. Give me your hand, Kemi. Give me your hand. Yeah. Kemi, I get you. Yeah? You'll be fine. Are you strong? Are you strong? Huh? Kemi. Kemi, are you strong? Please now, Kemi, please. Please. Please, oh. Please. 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 Please, Kemi.
We can also say that this brain drain of a thing might also affect this same hospital because maybe they did not have enough manpower. Maybe most of the doctors and nurses, they've already jacked back from Nigeria. Now, when we say you don't watch this video now, at least you don't learn 1 or 2 things from this video. Why, please help me subscribe to this channel because I've got a deal with my wife that any video that I drop, at least 1 person will subscribe. Otherwise, she's going to kick me out of the house. And I'm sure you wouldn't want that to happen. So kindly please subscribe to this channel and let's go.